If I have sleep apnea, the first thing that doesn't pop into my mind is the dentist can fix that, right? Because it's like, it's a different part of your brain. There's almost a disconnect there. So how have you been able to grow this?
So there's 3 treatments for sleep apnea: a mask called the CPAP machine, an oral appliance, and then a surgical procedures. So I started internally, then educated my patients that I do this. All new patients got a new screener form that asks questions like, hey Gary, how well do you sleep at night? Did anyone tell you that you snore? Do you feel tired throughout the day? Have you ever woken up gasping for air? How many times do you get up to go to the restroom at night? Do you grind your teeth? All the things that I teach that are correlated with having sleep issues.
Welcome back to another episode of the Dental Marketing Go. I'm your host, Gary Bird. I'm the founder of SMC National, where we help you create, convert, and close more new patients so you can grow the way that you want, but I have no clue how to create and convert sleep apnea patients. And today I have Dr. Rad, who has a practice in Southern California, very competitive market, and he is super successful with sleep apnea. And he's going to share his secret to success and how he's overcome sleep apnea himself after a tragic accident that caused him to start treating himself for sleep apnea. And now he's doing it for tons of patients, and he's going to give away all of his secrets. You're going to want to hear this one. Stay tuned. All right, we are live, and I got Dr. Rad, the one and the only, and I'm super excited to have this conversation because I'm going to get to learn something new, and I love learning on these podcasts. So, Dr. Rad, we just got done talking for a little bit. You're in a very competitive market in Southern California, lots of dentists around there, lots of patients, lots of money, and I'm really curious on, and the audience is going to love this, what is the number one thing that you're seeing that's helping your dental office grow?
Sleep apnea and snoring treatment. Because Gary, nobody wants to sleep next to someone who snores or has issues sleeping, because ultimately it affects their mental health, let alone their medical and dental well-being. Ever since I incorporated sleep apnea into my practice in 2010, after I personally fell asleep at the wheel in 2009, embarrassingly, I crashed my car into a tree going about 35, 40 miles an hour into a tree. Waking up and going, what happened? Then I did get a home sleep test back in 2009. Lo and behold, I have mild apnea. They gave me a darn mask called the CPAP machine, and I couldn't wear it. And a few months later, I was patient 0. I made a mouthpiece. And my bed partner had signed. She's like, yeah, you're not snoring anymore. At the tender age of 32, I was snoring, and it was weird, especially if you have a couple drinks or you're more tired throughout the day. You tend to snore more. So that pivoted me into I made over 1,600 appliances in the last 14 years. And that's about 35% now of my collections in my office. I'm still, like most dentists, bread and butter, crown bridge, implants. I do Invisalign. I do traditional braces. I learned for a 2-year program. So I've done a lot to add revenue to my office. Number one has been sleep apnea and snoring treatment.
That's awesome. So my number one question, because I'm a marketing guy, is like, how do you get these patients, right? So I'm just going to share the obstacles that I've seen. And again, keep in mind, take this with a grain of salt, because this is not my area of expertise. We work normally on, the normal dental procedures, like what you listed, full arch, all the way down to like a filling or an emergency and everything in between, but not sleep apnea. And the biggest disconnect that I've seen is like, hey, sorry to interrupt the show, but I want to make sure that you're going to Dicoma 2024. It's July 10th through the 12th. And guess what? We are going to be speaking on the main stage, and we're going to be hosting a boot camp as well. And we want to give away some free tickets. So how do you win these free tickets? You go to smcnational.com, click the little bar that says enter to win free tickets to Dicoma, and then you submit your information, and everybody's a winner. We're going to be giving a discount to everybody who enters. And we're going to be giving away some free tickets to the conference itself and to the boot camp. Make sure you sign up for these right away. Back to the show. If I have sleep apnea, the first thing that doesn't pop into my mind is the dentist can fix that, right? Because it's like, it's a different part of your brain. It's like, my refrigerator broke down. Let me call my auto mechanic, right? Like there's almost a disconnect there. So how have you been able to grow this?
So there's 3 treatments for sleep apnea: a mask called the CPAP machine, an oral appliance, and then a surgical procedures. And the oral appliance is deemed as the second line of defense if a patient doesn't want to try a CPAP, which most people don't, or if they fail it, meaning they try it and about 70% of patients give it back to their MD and now they're stuck. An oral appliance can only be made by a dentist. That's why when I train doctors on how to do this through my courses, there are already patients in your office coming in and out. They've already had sleep studies, some of them, and they just can't tolerate the CPAP or can't wear one or don't want to wear one. So right away, after you get trained, one of the biggest things I teach in my courses is, okay, you learn how to do sleep and snoring through a one-day course through radseminar.com. You're very confident in what you're doing. Now you got to go and tell your patients that you do it. So it's called an email blast, an SMS messaging. Do you snore? Do you know anyone that snores? Dr. Rad can now help you with that, with an oral appliance. Most patients have absolutely no idea there is an oral appliance out there. So you got to educate your internal base. We call that internal marketing, right? And then I teach how to go externally, because once you start doing it for your existing patients who already have mostly trust with you, and they come in and I, by the way, I started with myself, and I made one for a spouse of a staff member of mine. So I kind of got into, the appliance costs about $350. I made one for free for the husband of one of my staff members, and he was like, wow, I sleep better. And my staff member is like, yeah, he's not snoring as much. So I started internally, and then educated my patients that I do this. All new patients got a new screener form that asks questions like, hey, Gary, how well do you sleep at night? Did anyone tell you that you snore? Do you feel tired throughout the day? Have you ever woken up gasping for air? How many times do you get up to go to the restroom at night? Do you grind your teeth? All the things that I teach that are correlated with having sleep issues. So email, social media, SMS, internal marketing, poster, or canvas art in your office, looping video that I have. That's a really cool video that's about 1 minute and 45 seconds. Got to educate your existing patient pool first.
Okay, I love that. So it's internal first, then go external. Now, which is smart, right? That's a smart way to do it, and probably not the fun, sexy way that a lot of people think of it, but that is the smart and wise way to go, because you can get your skills up, get your team trained, do it with people who already trust you, so much less bumpy road. Now, one of the questions that I have around this is like, how do these patients? So when you're getting these patients in that you're doing sleep apnea, are they then turning into dental patients? And then I have some other questions around after that. Let's deal with that, and then I have some other questions after that.
Yeah, real quick to answer that is the patients that I'm getting that are not my existing dental patients that are coming in from referrals from, let's say I treat you, Gary, and then, you tell your buddy, hey, this mouthpiece is not letting me snore anymore and I'm sleeping better. Then John comes in. John may not be my dental patient, right? And so I'm seeing anywhere between 10 to 15% conversion. That's an actual number of patients who are my sleep patients who don't have a dentist and become my dental patient, which is kind of cool. That's a new patient. I don't try to steal them from another dental office, but some of them don't even know that I do general dentistry 65% of the day. So we try to let them know. And by the way, do you have a general dentist? We'd love to see you. We're still accepting new patients. Oh yeah, I know I have Dr. So-and-so. Great, no problem. If
10 sleep apnea patients come in, 1 to 2 of those are going to convert over to stay as a dental patient.
Correct.
Got it. Okay. And then, so here's the next question. This one's a little more technical. So when people, a lot of times dentists will like add aligners, right? Let's use aligners, a Invisalign or something like that. And they're like, this is great, and they kind of sell themselves. The patients are asking for them, right? Like they're not hard to sell, especially with patient financing. But then what the dentist ends up running into the problem with is like, oh, I didn't realize I was going to have to spend 12 hours on this case, right? And then they get the lab fee. And then by the time they're all done, after the finance fee, they made like $1,000 for like 5 hours of their time. They're like, dude, I could have just done 20 crowns or, you know what I mean? Or 10, 40 fillings in that time or whatever. So there's like this, operational nightmare or technical nightmare of how to actually handle those cases to make them work. Now people figure it out, but that's the nightmare that sometimes people get trapped on. On the opposite end, then you got like full arch where it's like, man, we can do this. It's hard treatment to do, takes a lot of time, but the money's huge. But then you need like to change your whole operational system of, You need a special person who's answering the phones because the person you have now doesn't know how to do it. You need a special person presenting the treatment because your current person doesn't. So you need like new people or new skill sets to actually learn to be able to do that effectively. So there's like these hidden traps that kind of get you. And again, people figure it out. What's the hidden trap with sleep apnea that gets doctors caught up when they try to go into this field?
So really we charge 4,000 to 8,000 for aligners. We charge 3,500 to 5,000 per implant, abutment, and crown. And we don't even look at the insurance relatively because most of the time insurance isn't even covering these things. And maybe if it does, it's a little bit from the dental insurance. People get stuck on medical insurance covering sleep appliances. And I teach how to do that. I teach how to use a certain medical billing company that if you don't get paid, they don't get paid. They take a certain percentage. And on average, medical reimbursement for an oral appliance is anywhere from, on average, about $2,900 to about $6,000 per appliance. My cash fee for an oral appliance is $2,500. So you're looking at close to about $2,500 to $3,500 per appliance, which the lab fee is about $350. The amount of chair time for a really skilled sleep apnea providing dentist is anywhere from 30 to 45 minutes total. Let's call it an hour for the average dentist. And that's it. But you have to remember, Gary, it's very important to straighten teeth. We've learned that. How important is it to add 12 to 15 years to someone's life who has moderate to severe apnea? How important is it for them to sleep next to their bed partner? Lower their blood pressure, acid reflux, 5 times higher risk of cancer of any kind. I mean, what kind of price value do you put on those few things that I just went over that a lot of these people are suffering? They already have had sleep studies, and it's like a no-brainer. So the roadblock.
So what's the doctor? So what's your time on this case? Like how much time
about
are you?
30 to 45 minutes total time. That's including anywhere from 3 to 4 appointments total.
And that's because you've been doing it for a while, right?
Yeah, on average, I would say it shouldn't take you more than an hour. The impressions and the bite are done. Scan and bite's done by the staff member. The bite's done by a staff member. I train how to do that. The doctor can do it. It takes 5 minutes to do the bite, maybe less.
But an hour of doctor time, that's pretty good. If you're charging $3,000 and your 10% lab cost of $300, I mean, that's really good. You just beat Invisalign from a profitable standpoint. And then you're only spending an hour on it, like on and you can get that way down if you get better and faster at it. And how often does insurance cover it?
It depends on the medical deductible. So if we're talking Medicare, they cover it every 5 years. But if you're talking medical PPO, not HMO, HMO won't cover it. Medical PPO depends on your deductible. If you have a $5,000 plus deductible that needs to be filled up, it's a cash patient. And so, but there's UPS, for example, pays $7,600 for their appliance, and I've helped 16 UPS drivers in my county here in Ventura County with oral appliances. 16 times $7,600 because their insurance has only $100 deductible, and it's covered at 80%. And the billable amount for an oral appliance is $9,500. So the numbers are there. And again, forget insurance. If that's your roadblock, which a lot of people come to my courses say they are, charge a cash fee of $2,500 to some people charge up to $5,000-$6,000, and you're doing such a service to patients. Yeah. People are willing to pay for that to be able to sleep next to someone and not snore, let alone the slew of medical conditions you're going to improve.
Yeah, I love that. Okay, so what's the downside? Like I've seen a lot of people online talk about this, right? Like it's out there, but a lot of dentists just haven't picked it up. I would say the vast majority haven't touched it. What is the hang up? What's the part that we're missing of why the doctors are not jumping on board with this?
Great question. I've trained over 3,000 dentists in over 10 years, and about 300 of them are doing it consistently. That's about 10%. Does that mean that I'm not a good instructor? I don't think so. Everyone rants and raves about how I make it real and you don't have to like purchase equipment afterwards or anything like that. It's really because you don't have someone holding your hand when Monday hits or the following week hits or the following week hits when it comes to some sort of like patient requesting something, sleep study going wrong, home sleep study didn't go out. So what I do differently now is I've actually, over the last few months, I have a program that the doctors that take my course, I have a mastermind on a weekly basis. They have one-on-one calls with me. It's a guaranteed success to work, to return on investment, if you want to call it. But more importantly, let's not forget the heart-centered care that I call it heart-centered because it's such an emotional treatment that you're doing for patients. And so once you do 1 a week, 2 a week, you'll realize, and when I show you how to get medical doctors to refer to you, you'll realize how important this is in your practice because it adds at least a couple $100,000 to your office on a typical basis. And to be more consistent, just like Kobe Bryant had a coach, just like you probably have a coach and I have a business coach, you need a sleep apnea coach to be able to guide you to doing more appliances, keeping you on the screening, looking in the mouth, looking at the lower front teeth wearing, looking at the side of the tongue and scallop tongue, which is one of the things that's very prominent for sleep apnea patients, and reminding you, hey, don't forget to take the 3-point shot. Don't forget to look at the lower front teeth. It's really just being on you and having people be accountable for screening.
That's awesome. If someone wants to reach out and learn more about this, how can they get in touch with you?
So my website, radseminar.com, has my courses. You can also direct message me from there. My Instagram, Dr. Rad Health, Dr. Rad Health. I answered to all my DMs. I've had doctors join my courses through there. So initially, you got to get trained. Even if you've been trained, let's do it the Rad way, as I call it, which is making it super easy, simple. You learn it all in pretty much one day. I also have like 1 hour snippets of the courses, marketing, how to do your social media and all that. And it's fun. It's fun because you've got a lot of doctors now that are taking more time away from clinical dentistry. They put associates in there that have finished my program. They're having more time with their family. They have more energy. They're not hurting his back as much. One of my doctors is clearing over $800,000 a year now doing sleep, more than I'm doing almost. He's doing great, and I'm blessed to teach this kind of thing because it's not only just about the money. I know that's some motivating factor, but really you get some hugs and emotional situations with patients that really truly value what you're giving them.
Yeah, that's awesome. Well, thanks for coming on. You did a great job, and I definitely learned something today.
Thanks, Gary. Thanks for having me on.